Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare and ProodianHealthcare.com, where health literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to help you and your families to feel better, function better, and live as many quality disease-free years as possible. Thanks for joining me this week. We're in a multi-part series of topics, but the topics are all related around reconditioning and exercise, which I shared with you last show is really something that I struggle with in private practice because I see so many people not only struggling in not knowing what to do, but also getting very discouraged as they're trying to do it. They also end up injured. So there is a good amount of byproduct to making poor choices and bad decisions about starting an exercise program. I'm not blaming you guys. I blame the field, the gyms, and the various places that we go to quote unquote get into shape. It really don't do a very good job many times in the instruction aspect of looking at somebody in stages. We start off possibly in a deconditioned state and we want to get into better conditioning. Well, if that's our goal, but we're all different ages, different genders, we have different backgrounds, we have different health conditions. Like I shared with you in last show, it starts with creating a plan, a written plan on paper. You have a financial plan, right? You have maybe an insurance plan in your life. You have probably a retirement plan. This type of a plan is exactly like that. It needs to be written down in a health journal, and it needs to identify first the why. Why is it? And what are the benefits of exercise? And we shared with you the benefits of resistance training and aerobic training last time. We talked about action steps to get started. We identified common obstacles, like I don't have enough time, I don't have enough money, I don't know what to do. All of those various complaints and problems and the issues that people make for excuses. What's the price we're actually paying for these bad habits? And not only the bad habits we have, but then we go and take the advice of someone and we end up injured or discouraged. And that's what we really want to try to avoid in our conversation about exercise and fitness. So let's keep the topic going. Remember Luke 1:37, for with God nothing is impossible. Nothing is impossible if we're following God's plan. We remove ourselves from man's plan, and it's not about the scale and the mirror. That's not what fitness and exercise is all about. Fitness and exercise many times begin with us wanting to increase, get a sweat going. We want to not injure ourselves. We want to increase circulation to our brains. We want to build healthy muscle. We want to improve our BMR, basal metabolism rate, the way our metabolic rate is working. We want to reduce the stress on our thyroid gland, for instance. Exercise has so many far-reaching health benefits that we're designed to exercise. It's just that we're not all designed to jump on a treadmill for an hour and a half a day. So how we design a reconditioning program that's right for you, that program starts with going to someone in the know who can look at blood analysis, do a body fat measurement, look at the amount of fat mass you have on your body, the amount of fat-free mass on your body, and looking at the limitations you might have in your life, like I just had knee surgery or back surgery or shoulder surgery, and looking at it from the perspective of reconditioning and rehabilitation. So as we move on with our discussion, let's make it a habit to read our health journal in the morning. Read it a couple of times a day when you're contemplating skipping a workout or a healthy eating habit. Read why it's important to you. My first slide of every program that I run through my Wellness at Work program. So I travel New Jersey and I do a lot of public speaking. The slide is a picture of my wife and my 5 children because that's the why. Why do I want to take good care of my physical, my mental, and my nutritional well-being? And it's because I want to be here for them. Now, I can't I can't stop tragedy and trauma from happening. But while I'm on this side of eternity, I'm going to do everything, within my power, within reason, to take good care of myself. And I have that health journal, and I have those pictures as my reminders. And maybe that's something you want to do. So as we get into an exercise and fitness program, let's start by dispelling some of the common myths that so many people believe. They believe I was first told that it's best to diet and lose weight and then exercise and get fit. This is a massive misconception and a myth. First of all, I would never use the word lose weight. What are we losing? Are we losing fat? Are we losing muscle? Are we losing bone mass, air, water? We have to measure objectively what we're losing. Those are biometric measurements. So the way to become leaner and healthier is to be more active. You must exercise while you improve your eating habits. So if we're going to start a reconditioning program like at Natural Healthcare Center, which is my office, we many times start off with, yes, a nutritional program, whether it be a detoxifying diet, a hormonal-based diet, a gluten-free diet. Maybe a patient needs to reduce the amount on a glycemic index dieting. I practice with Dr. Oscar Coetzee, who's a PhD in nutrition, and Dr. Coetzee we write our own programs. We don't call them diets, based upon the need of that individual that's in front of us. While we're doing that, we're also recognizing what level of decondition that patient is in, so that the reconditioning program not only includes exercise, but it not only includes nutrition, I should say, it includes the proper exercise. Next one, if I exercise regularly, I won't have to worry about how much I eat. Now, this is a massive problem, and hopefully you caught this as being a myth. With regular exercise, it becomes even more important that your nutritional habits are consistently healthy. Consistently healthy. And you could go back into some of the earlier shows that I did on nutrition and inflammation on the By Design tab on tandemradio.com. So just like we build a financial plan in our life or a retirement plan, we're building a health plan, and that health plan requires that we should be exercising and doing something that we enjoy to do, and our nutritional habits change with it. The next myth: to lose weight, I need to eliminate fat from my diet. This is, again, a myth and not true. Fat is an essential macronutrient that must be in balance with your diet. I did shows on the carbohydrates, fats, proteins, vitamins, minerals, and water being the essentials of life. Fat is an essential to life. You would die without fat. So eating healthy types of fats is what's essential. Eating man-made fats is what we want to avoid. Things like corn oil, hydrogenated corn oil, things like, for instance, in the sugar world, high fructose corn syrup. We want to avoid eating rancid, bad fats made in laboratories that don't resemble what is made by God, by nature, that exists naturally in nature. So fat is an essential component. You do not want to eliminate fat from your diet. You just want to get rid of the bad fats and eat healthy fats. The next one, the quantity of food that I eat, not the quality, is what will allow me to lose weight. Completely not true. The quality of your food is essential. Okay, making smart food choices consistently proves the essential nutrients that will optimize your body's metabolism and physiology from the inside out. So that formula gets results. Okay, we want to get results, and we have to improve the quality of our food. Okay, and that's an essential one. Aerobic exercise is all that I need to do to lose weight. This is a huge myth. Aerobic exercise means with oxygen. That's what aerobic means, and it means like running, bicycling, treadmill. This is not true. To lose weight, you have to build metabolically active lean tissue. That's muscle. You build muscle through resistance exercise, and it's vital. It's a vital form of exercise to optimize body composition. So as much as I'm a big fan of doing aerobic training, we cannot neglect building muscle through resistance exercise. Okay? Next one, free weights are for serious weightlifters only. Completely not true. Okay? Light dumbbells and exercising with free weights, when performed performed correctly, continues to be the best form of resistance training for anyone. So getting some light dumbbells and learning how to use them. I know I survived while I was a couple of years during school because I didn't have the money to join a gym with a set of dumbbells next to my bed. There's a lot of different exercises you could do with very low cost exercise equipment without the need of big expensive machines. So when we look at the fact that free weights are not for serious weightlifters only, that's an important myth that we're talking about. The next myth: weight training makes you bulky and inflexible. I get it all the time. I get my gals, they show up, they say, I don't want to look like Arnold Schwarzenegger. And I tell them it's impossible if you look like Arnold Schwarzenegger. You don't have that much testosterone in your body. Not to mention there's a whole host of other reasons. Just because you're doing weightlifting, when performed correctly, a balanced weight training program not only builds strength and endurance, but also improves mobility and flexibility. And guys, this is essential for my audience who's over the age of 50, 60, 70 years old. We need to stop thinking about bulkiness, about building those big gigantic muscles that we see in the magazines. That's not going to happen with strength training, okay? It's actually so important that we include strength training. Your metabolic rate and your longevity is based upon it, okay? So we want to improve mobility and flexibility, strength and endurance, and that weight training is essential. Next one: if I stop using weights, my muscles will turn to fat and I'll look flabby. First of all, let's make the distinction physiologically that muscle and fat are two different types of body tissue. You cannot turn one into the other. Not exercising and being inactive will make you flabby. Once again, not exercising and being inactive will make you flabby. Not by using weights and then all of a sudden stopping. That muscle does not turn into fat. We want to, if I haven't found the right exercise program, gimmick, or device that can produce the results I want, what do? Persisting with regular exercise of moderate to high intensity gets you the results you want. Forget about the infomercials and everybody trying to sell you something. Let's follow the plan of design. Our design requires us to exercise daily, regularly, from moderate to high intensity, and proving our muscle endurance as well as our muscle flexibility and strength. Okay? So when we look at the exercise program and guidelines, before we begin an exercise program, consult with a physician. You want to get a good physical. You want to do a thorough blood test. I'm always up in arms when I see people come in with these inadequate blood tests. Let's get thorough blood tests taken. And then from there, we want to look at what are the things this group of people that I'm about to go through, this group of people should never just walk into a gym. Excessively obese, that makes it difficult walking. You have angina with very minimal exertion. That's angina is like chest pain, okay? You had a recent heart attack. You had a severe valve heart disease. You have an irregular heartbeat. You have uncontrolled diabetes. You have blood pressure greater than 180/110. You have an acute illness, or you have a resting heart rate over 110. These are the things that you certainly don't want to just go join a gym with. These are potentially life-threatening conditions, and you want to consult a physician, someone who knows your case, someone who's going to work alongside with you and a proper exercise program. If you want that list, please email me and I'll send it to you. Excessive obesity, angina, recent heart attack, irregular heartbeat, uncontrolled diabetes, blood pressure greater than 180/110, an acute illness, or a resting heart rate over 110. So now we're ready to go. Now we've done the biometric measurements. I've done my consultation. I've sent you out for bloods. I've put together a written, underline the word written, program of nutrition and fitness, and now we're going to go embark on that program. And that program of exercise should, of course, include a thorough warm-up. Okay, we want to decrease our risk of injury. We want to loosen up our muscle. We want to increase blood flow. All right, so some aerobic conditioning in doing this is like jogging, cycling, stairs, rowing, elliptical, just walking fast. It engages your fat-burning metabolic rate. Choose an exercise that does not negatively stress your joints. Okay, so many people run, and running is such a stress on ankles and knees. So we want to be careful of that. Exercise in your heart zone, and you should learn what that means. And we want to look at doing exercise sessions at least 3 times a week. And we want to perform aerobic exercise, not on a full stomach. We want to make sure that we haven't eaten too close to doing an aerobic exercise program like running, cycling, and stairs. Interval training is my favorite. I really enjoy interval training. I like breaking up the workouts between aerobic, anaerobic, stop, start, making it fun, making it intense but fun. And obviously, please stop exercising if you ever feel pain, dizziness, or nausea. So our aerobic conditioning, when we go out and we're looking to do those types of activities after we've done a thorough warm-up. Remember, warm-up always comes first. So after we've done a thorough warm-up, if we're looking to do that aerobic training like 3 times a week, exercising in our heart zone, jogging, cycling, stairs, rowing, elliptical, fast walking, all of this type of stuff gets your heart rate up into that healthy zone. You're in your heart rate zone. Basically, it's a formula that's used: 220 minus your age times 65 to 75% is how you figure out your heart rate. That's how you take your pulse. And again, consult with someone so you learn these things. On a radio show like this, I really can't walk you through these steps. Hopefully you're taking notes, or you could even email me and we could figure this stuff out together. But learning aerobic training is very important. We'll end the show there because we're going to pick up next time with resistance training. We're going to talk through a resistance training program, how you put together sets and repetition. But again, go back to the earlier shows if this is the first time you're listening to me, because learn about reconditioning and the steps we have to take to get to this place where we're actually in the gym. You've been listening to the By Design radio program, and thank you for joining me, Dr. James Proodian, for this episode. I pray you have a wonderful week, a blessed week. Let's do things that are healthy for ourselves and our loved ones, and God bless.